Have you ever had a patient who's wheezing so loudly you can hear it from the doorway? But when you place your stethoscope on their chest, it's quiet. You hear maybe some faint crackles or coarse breath sounds, but no distinct wheezes. It's confusing, right? Well, that, my friends, might not be asthma. It could be something called cardiac wheezing, a sound that comes from fluid overload, not constricted airways. Let's break it down. When the left side of the heart struggles to pump effectively, pressure builds up and backs into the lungs. This forces fluid to seep out of the blood vessels, into the surrounding tissues, and even into the larger airways. This fluid buildup narrows the main bronchi, creating turbulent airflow that produces that loud, audible wheezing sound. So even though your patient sounds like they're having a full-blown asthma attack, the root cause isn't their lungs, it's their heart. Here's the fascinating part. With cardiac wheezing, you'll often hear the sound clearly without your stethoscope. But when you listen directly over the lung fields, you might not hear much at all. That's because the noise is generated in the large central airways, not the smaller bronchioles where your stethoscope typically picks up asthma-related wheezes. You'll likely see other clues, like a rapid heart rate or high blood pressure, elevated BNP and vascular congestion on chest X-ray. So, what about reaching for a nebulizer? Will a bronchodilator treatment like albuterol help? The short answer is usually not much. The underlying issue here isn't muscle spasms constricting the airways. It's a plumbing problem, too much fluid. While a nebulizer might offer some temporary psychological comfort, it won't fix the real problem. What actually works? We need to treat the heart and reduce the fluid. This means reducing the preload to take the strain off the heart. Diuretics like IV Lasix are key here, along with carefully managing the patient's fluid status and taking steps to improve cardiac output. Once you start getting that excess fluid off, you'll see a dramatic improvement. The wheezing fades away. Not because the airways were magically opened up, but because the fluid that was causing the obstruction is gone. You can literally see the difference on a before and after chest X-ray. So let's recap the key takeaways. First, if you can hear wheezing from across the room, but can't hear it through your stethoscope, think cardiac. Second, look for other signs of fluid overload, crackles on auscultation, peripheral edema, a high BNP level, or elevated blood pressure. And third, remember to treat the heart, not just the airways. Next time you encounter that strange wheezing that just doesn't add up with your assessment, trust your ears and your clinical judgment. It might just be the heart trying to tell you something important. Thanks for watching. If you found this helpful, be sure to like this video and subscribe for more critical care tips. See you next time. Let us teach each other.